Welcome to the Saving with Steve show, where we talk about the ins and outs of money, pretty much everything in the sun that relates to you having a happier, healthier relationship with money. My name is Steve Sexton. I want to thank you for joining us today. I want to thank you for sharing us with your friends, family, and associates. We're well over 1 million listeners here in the United States. We've just exceeded 250,000 listeners overseas. So we really appreciate you. Folks, we've had so many people reach out to us. What the interesting thing about the topic of this episode, which is the cost of caregiving for aging parents, is I really wasn't dealing with this issue until we started looking for providing information, obtaining information about this episode. And what happened is my father, my aging father, he's 89, had open heart surgery, spent almost 6 weeks in the hospital. And then my brother and I and sister have been providing care for him as he's gotten out to cover shifts, hiring caregivers, and all that kind of stuff. And even though I've dealt with this on a regular basis and helped clients with it, my sister has done the same thing. It was one of those things, it was a bit of an issue to navigate, to find the right company, to find the right caregivers, people who really do a good job. And one of the things that I found out is approximately 10% of the US adults currently provide unpaid care to their aging parents. In fact, 24% of people, adults have parents living with them. The typical caregiver dedicates 27 hours per week to caregiving tasks. Imagine your brother or sister doing that. 50% indicate the toll impact their employment, personal finances, because they're not able to work, especially they're probably 49, 50 at major earning ages. You know what? This experience has been eye-opening, eye-opening. And you know what? The reality is, this is the reason why we brought Gerda Maissel in today. She is a board certified physician and private patient advocate. The big thing about Gerda is she translates doctor speak into human speak, and she works with people who, helping them find solutions and help them develop the peace of mind and confidence with their medical and caregiving decisions. Now, many of her clients are caught by surprise, and maybe you have as well, by the expenses associated with the last decade of life, as you put it here. And you really think about it, my folks are almost 90, and they're probably in the last decade of their life. And she frequently encounters clients who are shocked and unprepared of the true cost of caregiving for aging parents. And you know what she's really doing today is helping us, coaching us on what to expect, how much it's going to cost, how to decide what is needed, and how to not overspend or underspend. And just to that point alone, it was really very interesting when we were going through this, is, that first week coming back from the hospital, how should we set up the care? How should we manage it? All those kind of things. And we realized, we were like, let's see what we need. And that we realized that probably wasn't the best decision. So Gerda, I want to thank you for being here today. We really appreciate you. This really wasn't something that hit home, but now it does. So let's start. Gerda, our listeners and viewers are always interested. Why become a caregiving advocate? I know you're a doctor. What got you into this business, so to speak?
So I've had essentially, this is my third career in many ways. I was a frontline physician. Then I was a health system executive, so worked at a high level inside several different health systems and really saw how the behind the scenes decisions were made and how the money is made, and learned about all those hidden economic drivers that change how we deliver care as a country. And so much of why people are so confused about how things work is that there's a lot of economic incentives that are hidden. So I learned that part. And then at the beginning of the pandemic, I had just gone down to Florida, taken a new job, and I was actually up in New York. My mom was a little bit lonely and disconnected. She was in her late 80s at that point. And I got one of those calls. The friend of a friend's aunt and uncle were driving across the GW Bridge during a heavy rainstorm, drove into the bridge. He walked away and she became a quadriplegic on a ventilator. And I happen to know a lot about spinal cord injury because I'm a rehabilitation physician by background. And since she had a spinal cord injury, the friend connected me to the friend's uncle and aunt. And there I was on the phone, and this grown man was trying not to sob. And he said to me, "They're killing my wife." And I was like, "Can you?" And he was like, "Can you help me?" And I thought, I don't, maybe they're killing his wife, maybe something, but let me see what I can do. And as I got involved and I helped him a bit, I realized that he was right. She was in a place with lousy care. I ended up helping him get her to the hospital. He didn't realize that he could demand that she leave and get to the hospital, and she qualified. And after several weeks in the hospital, they were ready to send her back. And he called me in a panic and he said, they're trying to send her back. What do I do? What do I do?" And I said, "You say no." And it hit me like a lightning bolt that people don't know what they can do and what they can't do inside the system. Here, this man knew his wife was extremely critically ill, but didn't know how to get her to the right place, didn't know the medicine well enough to know what to do or what to say. And I realized after all those years of being a physician, being in leadership, that there's this huge gap where people know something's wrong, but they don't know what to say or what to do. And I thought maybe this is a business. Maybe this is something I can do. Maybe I don't want to be a corporate wonk anymore. When you're in leadership, you cut budgets. That wasn't fun. I wanted to get back to why I went into medicine, and I took the giant leap and I went back to what I like to really do, which is to help people.
I think that's wonderful. It's interesting. I've had a number of experiences through working as a financial person, and some of those people have said, "Hey, it's just me and my wife, nobody else. So we need you to commit to helping us if we need help." And I'm thinking, you know what? Somebody passes away, you know what? I will help them do that. And it really hasn't been that over the last 20 years. It's usually the spouse is in a situation where they're diminished mental capacity, and they've got to navigate the costs and fees of doing that. And usually I'm just setting that up and having people do that for them and helping them with that. But I never really knew all the little things that go along with it until it was my dad. So that was
Of
a bit
course.
that was a bit of an eye opener. And somebody who was a CPA, who was a CPA for these companies that provide the medical care, the home care, and things like that. And she explained to me that one of the people she works with is a CEO, and he explained to her how the income drivers are, like you were talking about. And she says, "Oh no, it's all about a contract. It is all about the contract and how they're getting paid on that contract and the hours that they
Uh-huh.
provide for that contract. That's what it's all about." And in many cases, you might get their best caregiver right up front, but then you don't get their best caregiver after that. So it's really important to understand what you're getting into before you do. So, you know what? That leads into my first question. The biggest question that everybody's asked was, when should someone start researching this? And I'm going to bet you have a really interesting answer for that.
I actually, my answer is boring, which is there isn't a one size fits all. Some of us are advanced planners and they want to read and research and feel prepared. But even the advanced planners, I can tell you, when you're in it with a loved one and all the emotions are flying around, it's really hard to be prepared. And other people will research it when they absolutely have to, when they're in the middle of a crisis. And the reality is that's when most people spend time understanding this, is when they have to. Because it's hard enough to make a will and plan, do I want to be resuscitated? Never mind research what it is that mom might need when she has some unknown condition in a few years.
And it's really hard to fathom one's death because you just don't want to think about that. So I totally get that, because I've heard that multiple times from people getting not wanting to get wills and trusts. I don't know how to deal with that just yet. And or some people say, you know what, with the long-term care and getting providers and figuring that out, you know what, I'm not there yet, so I don't even want to deal with it. So I think that's a great start, and I'm really glad you said that, because it isn't one thing that fits all. And I know you're going to talk a little bit more about that. Folks, stick with us. We're going to be right back. We're going to be with more Gerda and here in Staving with Steve. Hey folks, welcome back to the Saving with Steve show where we talk about the ins and outs of money. We've been talking to Gerda Maissel here, and we're talking about what cost of caregiving for aging parents. Now, one of the big things is, like we've been talking, there's some people who plan. That's not the vast majority of people. There's a lot of people who get into it when it kind of hits them in the face or kicks them in the stomach or whatever, whether it's their spouse, their wife, their mom and dad, or what have you. So the question is, what would be the best way to prepare and then kind of what to expect?
Yeah, so there are some things you can do to prepare, like not assume you or let's say you're helping your parents are going to be this way in this level of good health forever. We talk about lifespan and we talk about health span. Lifespan, you might live to 95. But that last decade, as you talked about earlier, is often when you're not so healthy. And it can be really hard to envision yourself being alive, but not healthy, and healthy in the way of you don't necessarily have the mobility that you once had. You might not have the cognition. You might not be able to make your own decisions anymore. You might not be able to live in your current environment. So, some thought as to what that might look like. Sometimes it means proactively moving to a community, a continuing care community, or some kind of other community where there's people around you. Sometimes it means just moving to a home which is all on one floor or where you can live on one floor. Sometimes it just means saving money in anticipation of the reality that you're going to likely either spend down so much that you're on Medicaid, with unfortunately often very few choices, or save money and have that money that you can use to pay for your own care. It's extremely expensive in that last decade, depending on how much care you need and where it is. And there's a certain amount of discretion in there in terms of exactly what you spend, but people are going to spend money far more than they often anticipate on care.
Oh, yeah. I think that's one thing that people need to realize because just in the first 4 days of dad being home, it was $3,500.
Oh, yeah.
So it's really
People are
fast.
shocked.
Oh yeah. Oh yeah. So you're looking at, in certain states is 15, $20,000 a month for that type of care. And you know what? If you're not prepared for it or haven't done something for it, it cannibalizes your assets pretty quickly. So it's very important. Now, when somebody's when somebody's looking to, okay, dad's, mom's having some health issues, they're going to need some care. What's the first thing they should start looking into when they start looking at companies? I know you can go online, you can source these things, and you have a list of these companies, you can start calling them and all that kind of stuff. But what are the big things that people need to be asking? What kind of questions that could make a difference for them if they ask them the right way to get the right answers?
So I'll give you a slightly complicated answer. Part of it depends, there's two pieces. These are the two sections of the complicated answer. The first section is what kind of help is actually needed. Many people start off by saying, I need a nurse at home. You're going to pay 150 bucks an hour for an RN at least at home. You might just need a companion. A companion is somebody who can, sometimes it's an aide, but it's a person who comes over, maybe make sure mom takes the medication that mom needs to take, make sure the dishes are washed, gets the laundry done, drives someone somewhere. That's that level of non-medical person, which I'll call a companion. There's lots of different terms out there, is one sort of level of service. Another level of service, and again, aid is often used for both this and the companion, is a person who's actually washing or dressing, doing things that involve intimate contact where you want somebody who's properly trained and who is going to be safe for your loved one if they don't have their clothes on.
Mhm.
So you want to define what's needed. Now, if your loved one has a trach, a tube in their throat, and they're at home and they need someone to suction them, or they need help with a wound, now you're getting into nursing and medical care. So, in three sort of very basic categories, it's let's just call it an aide companion who is a responsible person and kind, where you're not necessarily doing intimate care. Then there's an aide who's going to wash and dress and help with more intimate care. And then there's actually a nurse who might do wound care or other things that really require assessment and the skill of a nurse. So it starts with knowing what kind of help does the person need? What kind of category are we talking about? Because any agency you call is going to be listening for that. And some places only provide the non-medical type of care, whereas others mostly focus on the nurse. And then there's others that do all of it. So as you're looking at the different agencies, you want to figure out what it is you need. The other thing that's a common what it is you need mistake is a lot of people say, oh, we just need an hour or two. Yeah, good luck. At least where I am, nobody, except maybe if it's a lady who lives next door, is coming over for an hour or two. Most places have a 4 hour minimum. Sometimes it's a 6 hour minimum. And it comes down to basic economics. Why would this person come over for a couple of bucks and it takes them half an hour each way to get to you when they can find, when it's frankly, there's more people who want caregivers than there are good caregivers out there. So there's frequently a minimum. So be prepared. You don't have to have somebody there every day, but you have to be prepared for having enough for them to do to take up 4 to 6 hours, depending on what the minimum is. And then the other big hunk of this is your comfort with how the person is qualified. And what I mean by that is there's really 3 different ways you can hire someone privately. There's the what I call I got a gal for you method. The I got a gal is, oh, my neighbor's cousin's third Aunt Tilly knows a gal and she's great and she helped with this or that. Terrific. I've seen people use their house cleaners to do some of this work because they're nice people. They have good relationship. Or what's the next door neighbor's house cleaner? That's the I got a gal method. It's
Hmm.
completely private and it's usually the least expensive of all the different options. On the more expensive side, which is what most people assume they have to do, is agency model. In an agency, you get a licensed agency, has licensed staff, often overseen by a nurse. Not always, depends on what type of person, but there's a certain amount of oversight and licensure and state regulation, and in many ways is the safest way to do it. The downside of agency is that you're often hiring a shift, not a person. So if you want somebody from 8 a.m. to 8 p.m. Monday, Wednesday, and Friday, the agency will get you someone to fill that slot. But where people sometimes run into trouble is the someone they send may not be the same one. And if they get a bunch of different people, they're going to some more than others, and it can be hard to get the person you want. And then the other little piece about agency is that the caregivers often make the least amount of money because the agency, if they charge you 40 bucks an hour, that person's, or maybe they're, sorry, an agency these days is charging you 60 bucks an hour, that person's getting 30. They get half of what the agency charges you. So many times, even though there's safety in going to agency, you don't always get, despite a lot of attempts on the agency's side, the best people, because often the best people end up going down the I got a gal method because somebody they know knows them and refers them privately. And then the third, and just to mention it briefly, there are models out there called registries, which vet people for you, but in a registry, you're hiring them directly. And the problem with the registry is you've got to get the payroll and do those sorts of things correctly because it's more visible. The I got a gal method, honestly, in America is often under the table. You're handing cash to
Hmm.
somebody that
So if you're doing the registry, it's more like you're hiring somebody, they're your employee. So you've got to make sure you have your own workers' comp in case they fall, hurt themselves, all that kind of stuff.
you got it. And most registries offer an option where for an additional fee, they'll do the paperwork for you
Oh, okay.
and
And
the
then,
insurance, but it's an in between. And some people like it because it's often a little less than a regular agency, but the caregiver tends to make a little more. And so some people think that's okay, but other people prefer agencies because you have really good guarantee that shift's going to get covered. So there's pros and cons, and sometimes people flirt with all different models, and you can
Mhm.
mix the models till you find people. But at least this way, I'm trying to give you all a framework to hang your decisions on.
Actually, you know what? I'm going to say this real quick before we go to the break because we experienced all that. We had somebody who took care of somebody down the street, and you know what? Hey, this person. And then with the agencies, you're right, it was 4 hours, 8 hours, and 12-hour shifts. Nobody does an 8-hour shift from 7 at night till early in the morning. They just do a 12. And that was actually the easiest shift to get covered. And they were usually really good caregivers. They were great. The during the day stuff was hard to get sometimes. So that's where my brother and my sister and I had to fill in, especially for the first couple of weeks. And then as they become a little bit more consistent, but also we're realizing that with all the other Medicare home therapy and things like that, that they come over 2 or 3 hours and so on and so forth. We don't need a lot of during the day, and we're beginning not to need as much at night. So we're trying to figure that transition out as well. So I'm just saying that for everybody who's dealing with it, these are the things you're going to need to think about it. Hey, stick with us. We'll be right back with more Gerda Maissel. She's wonderful, and you're learning a ton. There's a gigantic amount of ahas just for me so far. We'll be right back with more Saving with Steve. Folks, welcome back to the Saving with Steve show where we talk about the ins and outs of money. Hey, I just want to say I truly want to thank you for tuning in. I appreciate for letting us sharing us with your friends, family, and associates about the show. All the replays are available at www.savingwithsteve.us. If you're enjoying the stories of helpful insight and information on Saving with Steve, then I encourage you to subscribe to our YouTube channel so you never miss a show. Check out a few of our affiliates at UK Health Radio, BBS Radio, Talk Radio New York City, E360 TV, Las Vegas TV networks. All these networks are dedicated to empowering you to solve problems, uplift your spirit, and live a life of personal financial freedom. You can also follow us on Facebook at Saving with Steve Sexton. You can check out the Insiders Club, get the guest gifts, behind the scenes stuff, the whole shot. Let's talk with Dr. Gerda Maissel. She's been outstanding, and we're just so happy she's here because she's just delivering all sorts of ahas when it comes to the cost of caregiving and the things to look for and so on with caregiving for your elderly parents. Now, one of the things that which is really interesting is in every little thing, especially with this and hiring somebody and dealing with it, everybody has these little misconceptions. They have little ideas about things are going to cost. The other part is a lot of times people want to hear about how people are being taken care of, but let's also talk about the safety that goes along with this. So I'd like to spend a little time just dispelling those misconceptions, maybe about costs, about safety, and about the whole experience there when you're finding somebody and somebody's actually caring for somebody that you love and care about.
So, a couple of thoughts for your audience. One thing is that the most common misconception that I run into over and over, hopefully people don't have this anymore, but I still hear it, is that Medicare is going to pay for this stuff. Medicare will pay for your hospitalization and you'll get a little bit of time covered after the hospital. But even when the nice lady in the hospital says, oh, yes, we'll send in an aide, they're sending in an aide to wash mom a couple of times a week. They're not sending in someone to stay with her 24/7. So if that's what mom needs, that's provided by family or that's hired.
Hmm.
And people are often really shocked at how much family is expected to provide privately. And they can even say it's not safe. So if you're in the hospital, if mom's in the hospital, and you say to the discharge planner, it's not safe for mom to be home without somebody with her 24/7, then that doesn't mean they're going to now give you a 24/7 aid. What that means is they will then send mom to nursing home rehab.
That's right. The reality is with my dad, he had to have antibiotics infused for him for the first week. So somebody basically showed up every day to do that. And then after that first week he was home, then the physical therapist and the dietitian showed up, but they were there for maybe 1, 2 hours, maybe three tops. And then, you know what? That's it. Then the rest is on you. So I just wanted to share that because it just echoes what Dr. Gerda was saying. You know what? I already know this because I deal with people in Medicare all the time. So I already know that they might help with retraining and development for 30, 60, 90 days, but that's all Medicare is actually going to cover. So it's important that people understand that just from Medicare. You know what? So let's keep going with that. Thank you. That was
Sure.
great.
Sure. Another thing that I've noticed is that it's really important. So in medicine, we call it med reconciliation. But at that time of handoff between the hospital and home, you got to take your loved one's meds or your meds if it's you and really look closely at what you were taking and what the hospital said you should take. It is not unusual to find a disconnect, a question, or even an error between what you thought you were taking or what you knew you were taking before and what they're telling you to take now. There's so many reasons behind it, but it is at a time where I've seen people inadvertently take two drugs that are from the same category and not realize it. Two of this essentially cousins medicines, and they should only be on one of them. And that's because somebody in the hospital didn't realize they were also taking this one at home, or they didn't carry that drug in the hospital. So they just said, take the other one instead, and they don't realize they shouldn't resume the previous one. So a very careful reconciliation of what was being taken before and what the hospital's telling you to take now, and then get a hold of your doctor if you have questions, because it is really common that it doesn't quite line up right.
And you know what? The interesting thing about that is we also experienced that. It's so funny. It's just like I'm echoing you here. But
Yeah.
you know what? When my father left the hospital, you know what? When you get a little bit older, you're probably taking a few medications. And there's probably 8 of them that he was taking. And I would say 3 of them got replaced with something else. And what you're saying provides a flashback for me because a few years back, one of my clients who had lost their spouse, it turns out that they continue to take the ones that they had at
Mhm.
home plus the ones from the hospital. And what
Mhm.
they were doing is they were taking extra blood thinners,
Mm.
which it turned into a massive problem for them. And he ended up right back in the hospital
Yep.
because of that. It wasn't until, and like you said, people just don't know the questions to ask or think about that. So I think we probably had 3 conversations with the doctors and the nurses to confirm what exactly was coming home. And we asked for the hospital to give us 30-day supplies of each of those, the stuff that he's coming home with, and what are the stuff that he's supposed to take that he's currently taking. So we were on the page with that. So if you're at the hospital, ask him for a 30-day supply.
Yep.
We didn't have a problem getting that. In fact, it was, even if we had to pay more, it was worth the money because then we knew exactly what it is and we didn't have to go back to the old stuff. But the more important thing is we got rid of the old stuff.
Yep.
So nobody had any confusion. So thank you
Yep.
for sharing that. That's just wonderful. I'm like, okay, we did
No,
that.
you did it. You did it right. And that's really good that you did it, because like you, I've seen so many people get into medical problems. And after you've been in the hospital, the last thing you want is to go back to the hospital or even the emergency room. It's exhausting. Nobody wants to be there.
Oh yeah, you have no idea. You know what? I'm a colon cancer survivor, so I know what it's like. I was there for a week. You have somebody show up at 3 o'clock in the morning, midnight. Every 3 hours, they're making sure you're okay, and they're talking to you, touching you, and doing that stuff. And you don't rest. You really don't. In fact, one of my dad's biggest thing was like, when can I get out? So.
No, absolutely. It's exhausting to be in the hospital, and people underestimate just the sleep disruption, just like you talked about, and how that affects you. Plus, you're also in bed and you're not moving around like normally, and that makes you more deconditioned. And then, not to mention, you're sick, and there's a reason you're in the hospital. It takes a long time to recover, even from a simple hospitalization. So, the last thing you want is to go back there.
Yeah, I totally agree with it. So, what are you know what, when it comes to, let's talk about the safety side of things. First of all, you talked about prescriptions. What other safety side of things should people be concerned about when an aging parent's coming from home from the hospital, getting care, things like that?
So we've talked about the drug, but another common thing that happens are falls. So you want to make sure that you have the right equipment, whatever that might be. One of the things where I sometimes see a gap in care is that nice discharge planner says, oh, we're going to send the visiting nurse in to see your mom. Then the visiting nurse is a little bit backed up and she doesn't get out for a couple of days. And then they say, oh yeah, we'll get PT. And then it takes a few more days for that to be scheduled. So don't expect, it's great when it happens because sometimes it does, that those nice visiting nurse people are going to show up immediately. But also be really careful to look at the home for fall risks. So what I mean by that is loose rugs are a classic. My mom had that issue. We weren't wealthy, but she liked what she called her Persian rugs. And she had a
Mhm.
couple of them. And even when she moved to another facility, she took one with. And I said, Mom, it's a trip hazard. And she said, I don't fall until she did. Take up loose rugs, watch for cords that are out there. When it comes to things like getting on and off the toilet, it sounds, who thinks about that? People fall getting on and off the toilet. So if toilet, that you can get these things that go over the toilet that give you, that raise the toilet up and give you handles. You
Mhm.
guys can't see me, but I'm pushing down, give you something to push down on. And also evaluate your loved one's judgment, meaning they could say, I'm fine, but maybe they are, maybe they're not. And if they're like thinking everything's the way it was before and they're jumping out of bed or they're just making bad choices, you may want to have somebody with them. And I often say, at least for the first 24 hours, stay with your loved one, have somebody there. And then you can get a better sense of, are they safe to be on their own or are they not safe? And while
Yeah.
you're there, you can pick up the loose rug.
Yeah, it was really interesting you say that because even the step up into your house, like just one step into your house could make a difference. Or going down a driveway, a slightly slighted driveway, could make a difference for somebody walking in that has just gotten out of the hospital. Because, you know what, just for me personally, I went into the hospital at about 210 pounds and I was only there a week and I came out at 170. Okay.
Oh,
And you know what? And I had a colon resection and all that kind of stuff. And I was younger and everything, but I still remember when I went to work out for the first time, I was leg pressing 20 pounds and my legs were shaking. I was so
oh,
fatigued. But
yep.
the thing is, and where I came from is I used to be able to do about 400 pounds. So it was a kind of a depressing moment, but that's the reality of it. Your body
Mhm.
hasn't moved, it's atrophied, it's got to build it. And I know my dad's dealing with it now because his legs were nowhere near as big as they were because before he went in, he was walking 5 to 7 miles a day. So it's a big change. And you know what? He's had to learn everything from getting off the toilet to getting out of a chair to how to get out of a car, just relearning those muscles. And when you have open heart surgery, you can't really move your arms above your leg, above your head. There's a lot of work that goes on there. So that is something that's really great. So folks, stick with us. We're going to right back with more of Dr. Gerda Maissel. Hey folks, welcome back to the Saving with Steve show where we talk about the ins and outs of money. We're here talking with Dr. Maissel about the cost of caregiving for aging parents. We've had some wonderful ahas. You're definitely going to want to listen to us a couple times. And since I've been talking to Dr. Gerda, she has a blog. And you know what? We're going to put that blog on our website. Gives you wonderful tips on questions to ask, what you should look at if you're going into the hospital, if you're coming out of the hospital. She's got wonderful things. Dr. Gerda, how often do you put out something new on your blog?
I write regularly once a month.
Once a month. Perfect. Go there once a month, not too much, just right. But now we'd like to talk about what to look for that's most important, the questions that we need to be asking the caregivers either when we're engaging with them, meaning hiring them, or when that caregiver first comes over the house. You've just met the new caregiver that's going to come in and provide the care. What kind of questions should you be asking? What kind of information should you be providing?
So let's take the interview setup. So I always like to understand, of course, you want to know is some what their training was. That's a given that we all know that if you're hiring someone to be a home health aide, you'd like it's nice if they're a certified home health aide. So you want to know what their credentials are, and you can decide from there whether it matters or not, but you want to know. But then I like to ask these open-ended questions, which essentially comes down to, have you taken, you may have said, my mom has this, that, and the other. And then say, have you taken care of people like my mom? And typically they'll say, oh, yes, I have. And then you say, I'm just curious, what kinds of things, all jobs, there's things you enjoy and things you don't like. And I literally asked the caregiver, what did you enjoy about taking care of that person and what annoyed you? What didn't you like? And the reason that I asked that is there's not a right or wrong answer, but you have your own values and you, without even knowing it, know what you're looking for. And so if somebody says, oh, it drives me crazy when they complain all the time, and you know that your mother complains all the time, and you know this isn't going to be a match, okay, you've pulled it out. If on the other hand they say, I love all different ones, and even the ones who complain all the time, it rolls off my shoulder, then you know it's more likely it's going to be a match. And so it's not a right or wrong answer. It's really just trying to get a sense of how does this human in front of you, this person that you're interviewing, think and react, and how do they like to work? Because you're looking for a personality match as much as anything else. You want certain skills, but that person's going to spend a lot of time, if you're hiring an individual person, not an agency for a shift, but if you're hiring an individual person, they become part of your family. They will love on your loved one. They're going to love them if they're good, and you're going to love them. And it becomes a very close relationship if it works well, especially if it goes on for a long time. So you want to get a sense that you like this person and that there's a good chance that they're going to and love your person.
I think that's so wonderful of you to say because I was just thinking about because I was there at 6 o'clock or 7 right when the new caregiver would show up. And when it was brand new, it was interesting because the caregiver would say hi, introduce themselves and stuff like that. My dad always asked a few things, but then they would sit down with a chair right in front of him and start asking me, tell me what happened. This is what I know. And I know they knew more. They were just getting him to talk so they can actually assess what's going on, how it's going, what help do you need? And they would ask, hey, where do you think you're going to need help? How do you think you're going to need
Good.
help?
That's good.
You know what? You know what? And then they would come to us. Are there any medications he's supposed to be taking and things like that to make sure he's on top of it? And you know what? Because my dad at the beginning needed the bathing, the going to the bathroom, that type of stuff. And basically, he's still living on the recliner that we got for him until he's able to get in and out of bed on his own, but he's working towards that. And you know what? One of his big things is he wants to walk. So he wants to
Mhm.
build up that stamina. He's, hey, I need to walk at least once. If we can go, it's in the next half hour, can we go? So they put on the belt with the heart pillow and all that stuff, and they'd take him for a walk and so on. So it would be very interesting because they would spend good 25, 30 minutes just asking him nice questions. And it was always nice because I said, how did things go? And they'd said, oh, Michelle's wonderful, or Jacqueline, Caroline's wonderful. And I always knew that it was the right person, if that makes sense,
It
because
does.
you can tell. And I understand where you're saying, hey, they really need to care, or you know they care. So I think that's great. Once you're at with the caregiver, are there any type of questions that somebody should be asking before they engage the company itself in the service? Is there anything they should know about that contract that they're signing? Because essentially they're signing a contract for a certain amount of hours or whatever it might be.
So I'm not an expert on the contracts themselves, but I can only share with you where I've seen it's not necessarily a reason not to sign, but just something to warn people about, where I've seen people get into trouble, which is if you're going through an agency, many of the agencies have a clause that prevents you from hiring the person separately, privately.
Mhm.
So I had a client who didn't like most of the agency people and really only wanted, we'll call her Marcia, only really wanted Marcia. And so she talked to Marcia, offered her a lot of hours, and Marcia said, okay, I'll leave the agency and I'll come work just for you. That wasn't allowed in the contract, and there was a whole back and forth. And most of the contracts have a time period, like you can't hire Marcia for a year, but
Mhm.
just be aware of that clause and know what you're getting into and try to avoid the hassle if you decide that you're going to try to do an end run around the agency. Not because you dislike the agency, but Marsha would have made more money and you would have paid less. And so there's practical reasons when it turns into a long-term care situation to hire because now you got a gal.
I understand the agency doesn't want somebody to poach their,
Absolutely.
and if you already know you're getting great service from one person, why not try? Because it is really all about your relatives. So I get that. And now let's talk about the research side of things. It's always important to research the company, the people, and so on. So, what would be the best way to go about doing that?
So that tends to be ask around and the good old-fashioned word of mouth. We all know go on Google, read reviews, et cetera, et cetera. But most people of a certain age have friends of that age in the area. And the more that you can find out that a certain agency had a great, someone had a great experience with that agency, the greater the chances are that you will have a great experience. Because the things that make a great experience are very hard to figure out from a website. It's reliable caregivers, people who show up when they say they're going to be, the agency that's responsive when there are problems, and there's always something that crops up. There's a lot of intangibles. And so obviously do your diligence and check online reviews, but it is still pretty good to ask around whenever you can.
Word of mouth is the best, or just getting somebody to say, hey, what was your experience? So I think that's wonderful. You know what, Dr. Gerda, is there any additional tips that you'd like to share with our listeners and viewers? Because you've given them some wonderful information so far. Just curious, is there anything else that people should know before they hire some caregivers, or is there something they should know when they decide they don't need that caregiver anymore?
The main thing that I see is the shock of how expensive it is. And you touched on that in the beginning, Steve. It is crazy expensive, and people end up doing the math. Sometimes people end up doing, if somebody needs around the clock care, it may make sense to have a live-in if the setup is such, because that's going to be less expensive than two 12-hour shifts. But sometimes there's reasons not to have a live-in. But whatever the choices of caregivers, expect that it's going to cost more than you can even imagine. And not just caregiver in the home, but if, let's say, mom can't stay in the home at the home that she wants to stay in, and you have to look at other facilities, they're going to be crazy expensive too. I was talking actually to a high school friend of mine just yesterday, and he told me that he's paying 60 grand a month right now for both of his parents to be in memory care.
Oh,
I mean,
wow.
he's not paying it, they're paying it, but he was having his own medical issue, but that came up. And we were talking about it. He said, fortunately, they lived very carefully. They've got money, but if they both live another X number of years, that money's going to be completely gone. So it can be shockingly expensive. This, we'll just call it the last decade, that gap between health span,
Mhm.
lifespan costs more than you can imagine.
That's $750,000 to care for two people. That's a lot of money. And I'm glad you said that, but it's not always that expensive. I just encourage
No.
you, you know what, most for me personally, with the people I've dealt with and the people I know others have dealt with to help them with this or deal with the cost, it's not always that expensive, but you know what, the more you can take the time to research the issues because you might be there one day, the better. Because if you, and I always like that, if you know where the exits are before the havoc occurs, you've got a great GPS and it's going to get you there safely. So I would encourage people to research. Dr. Gerda Maissel, thank you so much for being here. We very much appreciate you and the information that you provided. And I know everybody's listening today will probably listen a few more times just to get the little tidbits that you've said because there's a lot of little ahas there that people just don't know, even though you've heard them all the time. So now, is there any way that people would go about getting in contact with you? I know you're a patient advocate. So how can we support you?
Oh, so my website is, so my business is called My MD Advisor, where because I do medical navigation, and it's www.mymdadvisor.com. And then, not that it necessarily supports me, but it's nice when I to have people read my blog. That's on Substack, and it's called The Fog Light. and you literally just go to Substack. I think it's substack.com, and you type in the fog light and you can find it. It's free. I do it because I want to, because I can, because I know that I have some observations and tips and tricks, and I want to have other people know that. So I write it, it's free, and people can subscribe and they can get it or follow or whatever they want to do. And the other thing to mention, and I realized as we were talking, I didn't mention, sometimes this can get so overwhelming that you might need somebody to help you pull this together. And there are both geriatric care managers who can be wonderful boots on the ground people that can really help, especially if you're not physically close to your parent. A geriatric care manager can really be there. And they are just, if people are looking for geriatric care manager, their website is ALCA, Aging Life Care Association, ALCA.com. And for people who are interested in whether just in general, people who do what I do, there are a couple of different groups. There's the Greater National Advocates, the GNA. There's NAHAC, National Association of Healthcare Advocates, and there's Health Advocate X. And all of those, whether GNA, NAHAC, and Health Advocate X, have lists of patient care advocates that can help people get through the system.
That's wonderful. That in itself is just gigantic. So thank you very much for all the resources, Dr. Gerda. We appreciate you being here. Folks, stick with us. We'll be right back with more Saving with Steve.